in India as a nation, where do we really stand? Because the numbers aren't really good. And looking at COVID, unfortunately, a lot of children, infants, have lost their moms. So which makes it even tougher. Nutrition is even more important now. As a country, do we fare good when it comes to breastfeeding? Are we breastfeeding our kids enough?
Sure. So let me first perhaps start by explaining what exactly do we mean by breastfeeding. It's a broad term, right? So there are three components to breastfeeding. The first component is that a mother should start breastfeeding within the first hour of delivery. Then a mother should continue to breastfeed the baby till the baby is 6 months of age. And once the child is 6 months of age and you've added additional foods to the diets of the child, which is called as complementary feeding, then you should continue to feed the baby for 2 years, breastfeed the baby for 2 years or beyond. So those are the three, let's say, components when we say breastfeeding. In India, we routinely capture data every 4 to 5 years through the National Family Health Survey, wherein there are a lot of nutritional indicators which are captured as well. So if we look at the previous NFHS 4, which was conducted in 2015-16, only about 4 out of 10 of our children were breastfed within the first hour of birth. If we look at how many children were exclusively breastfed, just slightly more than 5 out of 10 children were exclusively breastfed for 6 months. Now, when we compare that with the new data which has come in, the NFHS 5, which has only come in for about 22 states and union territories, what we realize is that 88% of women in India have delivered in hospitals. Within that, 51% were able to begin breastfeeding within the first hour of birth. 61.9% breastfed exclusively during the first 6 months. Now, if I compare the NFHS data, NFHS 5 data for these 22 states and union territories with the NFHS 4 data for these 22 states and union territories, we actually have come down as far as figures of early initiation of breastfeeding are concerned. So perhaps to say that we're not really doing that well, and there's more that needs to be done to make breastfeeding rates go up in our country.